Welcome to all those joining us today. My name is Shelley Hartland, and I'm the Director of Operations and Cultural Transformation for the Legatum Institute. It is my absolute pleasure to welcome you to this webinar to showcase our United States Prosperity Index and explore how it might be used to drive better health, wealth, and well-being in these extraordinary times. At the Legatum Institute, we are committed to creating pathways from poverty to prosperity for individuals, communities, and nations. To achieve this, we produce a number of indexes and data sets to help leaders around the world develop practical solutions to deliver genuine and lasting economic and social well-being. Our United States Prosperity Index is just one of these indexes. We're delighted to have members of the Helmsley Charitable Trust, the Robert Wood Johnson Foundation, and the Walton Family Foundation with us today. The generosity of these organizations has allowed us to draw on our 13 years of experience measuring prosperity globally to create a holistic and comprehensive analysis of how prosperity is evolving across the 50 states of the Union and Washington, D.C. As part of this program, we've undertaken a detailed county-level analysis for several key states, and we will be publishing this work later this month, so do keep an eye on our website. We hope this work will provide an objective means of considering how the US might emerge more prosperous from its current health, social, and economic challenges. In addition to our own speakers, we're absolutely delighted to be joined by two expert panelists today. Firstly, we have Dr. Georges Benjamin, who is Executive Director of the American Public Health Association. And secondly, we have Dr. Bechara Choucair, who is Chief Health Officer at Kaiser Permanente. Thank you both for joining us, and we look forward to hearing your reflections on the index, as well as America's health challenges and opportunities as you see them. There will also be an opportunity for our panel to take questions, so please do use the Q&A function to ask these, ideally including your name, organization, and who your question is directed to. If you have any general comments, please do use the chat function. We do ask that you choose the option of posting comments to both panelists and attendees, as this is a great way to start a conversation with others who are also joining us today. Finally, you can find our index data along with our current report and state profiles at our website, www.usprosperity.net. I'm now delighted to welcome our Director of Policy, Dr. Stephen Bryan, to provide an introduction to the United States Prosperity Index.
Good morning, and thank you, Shelley. My privilege really is here today to be with you to explore prosperity, to define it, and to help give you some background to the work that we've been doing on the United States Prosperity Index. So let us first of all consider, what do we mean by prosperity? Because this is, in one way, perhaps an abstract term that we need to put some flesh on in order to understand what we're talking about. Now, we have been defining, measuring, and ranking countries in terms of their prosperity for the last 13 years, as Shelley has indicated, in our Global Prosperity Index. And what we mean by prosperity when we're looking at that is going beyond typical economic measures, say, of GDP, and to say what we want to capture is both economic well-being and social well-being. What does it mean to have the environment that allows for a fulfilled life? And to do that, we need to get beyond that data and really think through the sort of structured elements of institutional quality, the underlying economic quality, and also the social well-being, the lived experience of people. And what we've seen, I think, over the last few months with the combination of the pandemic and the recent social and racial unrest is that sense that simple, narrow focus on economics is not enough. We need to be reaching out for a broader sense of well-being. We need to make sure that our public leaders are held to account for a greater sense of what's needed than simply reporting on economic measures such as GDP. But to do that, we need to understand and define what we mean. We need to have a system of measurement to do so. So on the next slide, we have laid out the structure. Shaun, if I may just check with you, I'm not seeing the slides on my screen. Okay, that's fine. What we have are three domains I was just describing. The inclusive society domain on the left-hand side has a set of pillars within it, and within that a set of elements of more granular detail, policy-focused issues. So when we say inclusive societies, what we're talking about are the institutional arrangements, all the ways in which we interact with each other to create society. So at one level, safety and security, the first pillar, looks at issues about violent crime and terrorism and property crime. So that's sort of the ways we don't want to be interacting with each other. Personal freedom looks at the ways in which we allow others to fulfill their own purpose in life, the extent to which people have agency, that they are free to go about their business, there's freedom of assembly and speech, the extent to which there's an absence of discrimination, the extent to which there's social tolerance. And this is a critical component of allowing people to fulfill their own ambitions, is that there is that sense of freedom in society. Governance focuses on the sort of power relationships, how we organize ourselves. So that looks a lot at political accountability. Is there rule of law? Does the government have integrity, i.e., is there an absence of corruption and a presence of transparency so we can all, as the public, see what's going on? And the final aspect of institutions, particularly the informal aspects, is captured by our social capital pillar, which looks at the strength of social and family relationships, looks at the quality of social networks, the degree of trust that exists within a community. And then also, beyond the community trust, institutional trust. Things like the government, the courts, the police, the media, are they trustworthy institutions or not? And the final aspect of social capital is the level of civic and social participation. Are people engaged in the community or not? So all these are different ways in which people engage, interact with each other. And that captures our inclusive societies domain. The middle domain, open economies, looks at what it takes to start and run and grow and build a business. What are the relationships that you need to have? Is there a regulatory environment that works? Excuse me. Is it possible to get access to finance? Is the labor market flexible? Are there other distortions that may inhibit that business management? Then we look at market access and infrastructure, which is much more around the sort of physicality of it. Is there a good transport network? Are communications well established? For example, is there good broadband or 4G, which in these sort of COVID times has become a crucial element of business? And also, at a more sort of fundamental level, is there consistent and reliable access to electricity and water? Economic quality then looks at how does that all play out in terms of the level of business dynamism, how many new companies are being formed, how active is the labor force, is it, we got low levels of employment, is there a good level of productivity and competitiveness? So that effectively captures the economic domain. Then the third domain, empowered people, focuses primarily then on the lived experience. So we look at living conditions, the degree of material resources, the quality of nutrition, the extent to which there's housing and shelter, and people connected to each other. So these are all the aspects that are often in the developed world described with respect to multidimensional poverty. These are the core components of living conditions, over and above simply getting money. Then, an area of particular concern for today's discussion, the health pillar, looks at the components of health in terms of what one might describe as a bit of a production function. We start by looking at the behavioral risk factors of the population. To what extent is there obesity, drug, alcohol, tobacco misuse, and in effect thinking what are those starting points that create a healthy life. Then we move on to preventative interventions. To what extent are there good immunization programs and other preventive tests and checkups? Then the core care system itself in terms of hospital networks, physician networks, etc. Then we look at the outcomes. Mental health, is it strong? Physical health, are people free from disease, communicable, non-communicable diseases? And then ultimately longevity. So these 6 components of health are a way of disaggregating health into its component parts so that sort of the DNA fingerprint of every country or every state of the union can be assessed across these dimensions. We do the same with education, looking at the life stage of education from pre-K through K-12 to tertiary education, and ultimately the skills, the adult skills of the workforce. And then finally, the environment. We look at the different domains, whether it be emissions, air pollution, the quality of the land, quality of fresh water, and preservation efforts. Now, what that does with these very policy-focused elements, which we then measure through multiple indicators, is gives us a very rich taxonomy. And by bringing all this together in one place, with a consistent set of measurements across a consistent set of geographies, we're able not only to measure and monitor progress, but also really start to get under the skin of the relationship. So, for example, if one was interested in the social determinants of health, we could be checking the extent to which nutrition affected health and which part of health does it affect, or material resources, or quality of shelter, or levels of employment, or other factors that you can see in different parts of the world, or indeed across the United States. So we believe that this definition of prosperity is very holistic, it's well defined. Every single one of these elements is measured and monitored at a global level and within the US. Now, what we've done over the last year or two is really dug into the US in more detail. Because when we looked at the United States at a global level, we saw what we would expect, which is, with the United States being the world's economic powerhouse, it ranks fourth on open economies. That was that middle domain. And that's, as you might expect, a high degree of economic dynamism, good rules for business, strong access to capital. But as we broadened our aperture and started to look at all the other areas of prosperity, looking at our global prosperity index, we're able to compare where does the US sit versus everybody else. And what we saw is that for the last 10 years or so, its ranking has been around 18th, which is a far cry from the fourth in open economies. What we see when we look at it is that there are many areas of strengths and some areas of weakness within the US, two in particular: safety and security, because of high levels of violent crime, and health, also weak, probably for two different types of reasons. One, while the US health system, and indeed we're in the company of some real experts here, has some fantastic hospital networks, some real areas of strength, has the leading pharmaceutical companies in the world, and is a place that many people come to get the best possible care. That care is uneven. The quality of health around the country is uneven. So that's one issue. The other, as we look at that range of different factors that we consider in health, what we see is that mental health is weak, globally speaking, and the behavioral risk factors are weak, globally speaking. So higher levels of obesity, higher levels of substance abuse than you find in other parts of the world. So that, for us, said, it's really worth getting under the skin of not just health, but all these components of prosperity for the United States. So a couple of years ago, we set out to look and see what's available, what can we build on? And obviously, and I think many people on this call will be familiar with the County Health Index, which is very good at capturing the health elements. We also could see that there was the Freedom of the United States, which captures elements of freedom around the United States. But we wanted to bring it all together to the full gamut of prosperity. And what we found was there was nothing out there that did a broad picture. So what we've done is we have, over the last year or so, built out, using experts, a replication of that idea of prosperity as applied to the United States. So the 50 states plus DC, we've measured prosperity across the domains that we're looking at: inclusive societies, open economies, and empowered people, and built out this picture of prosperity for the 50 states. And as Shaun will take you through in more detail now at a more granular level, at an individual county level. But before Shaun takes you through a view of health as through this lens, let me first of all play a short video that will give you some of the highlights of our United States Prosperity Index.
The Legatum Prosperity Index shows that prior to the COVID-19 pandemic, overall prosperity in the US had been rising for the past decade, although long-standing challenges mean that prosperity was not experienced equally by all Americans. Although the country was ranked high for economic pillars, it was falling behind in living conditions, health, and safety and security. Our US Prosperity Index shows that the country's economic quality had improved as unemployment had fallen after the financial crisis. This meant it was in a strong position before the virus hit, but of course that strength is now at risk. Improvements in education and living conditions had also been significant in driving the growth and prosperity over the past 10 years. Although education had been improving, school closures as a result of lockdown measures put the progress made on educational outcomes at risk. More positively, one area of living conditions that had improved significantly over the last decade was connectedness, with access to broadband rising in both rural and urban areas, enabling greater connectivity during lockdown. Health in America had improved over the first 8 years of the past decade, so the country was in a good position to deal with the impact of the pandemic. However, the mental health of Americans had already been declining even before the coronavirus crisis. There had been large increases in drug overdose deaths, rates of suicide, and levels of serious mental illness across all regions, with 48 states seeing mental health decline over the past decade. Deteriorating social capital was also impeding further prosperity. While personal and family relationships had strengthened, social networks, institutional trust, and civic and social participation had all deteriorated. The fact that only 11 states had seen an improvement in social capital since 2009 is a real concern, given strong communities are the cornerstones of society, and the decline in other states is indicative of societies that were already coming apart rather than drawing together. Despite these national challenges, the US Prosperity Index shows that before 2020, prosperity had improved in 47 of the 50 states, plus Washington, D.C., providing a strong foundation on which to build a recovery as the country emerges from these challenging times. But while all but 4 states had seen prosperity improve, no single state has yet succeeded in fostering a high degree of both economic and social well-being for its entire population. Other than top-ranked Massachusetts, no state ranked above 20th in all 11 pillars of prosperity. Now more than ever, it is vital that all states seize the opportunities to learn from each other to increase their prosperity and share their experiences with one another to help them improve.
I now invite Shaun Flanagan, the director of our Centre for Metrics, to unpack the index in more detail.
Thank you very much, Shelley, and good afternoon, good morning, everyone. As Shelley said, my name's Shaun Flanagan. I'm the director of the Centre for Metrics at the Institute, and it is my privilege and pleasure to lead the team that produces our indexes. So as Stephen has talked you through the sort of taxonomy of the US Prosperity Index, whilst we're experts at the Institute in measuring prosperity, we also wanted to ensure that we were reflecting local expertise from the US. And so we pulled together a team of about 40 experts who are experts across the 11 pillars of prosperity. So that's experts in health, education, living conditions, etc. And I just wanted to say thank you very much for their input and help in helping stand and construct this index. Without their help, it wouldn't be what it is. And so what we've ended up with is 11 pillars of prosperity with 48 policy-focused elements underpinned by 215 indicators. So when we look, first of all, at what does that mean in terms of how prosperity translates across the 50 states of the Union and DC, the map on the left shows that for the latest year. And what you'll generally see is a broad north-south divide. So 8 of the 10 weakest performing states are located in the south. And whilst the Northeast doesn't hold a monopoly on the top performing states, a large majority of the top performing states reside there. But there are others such as Colorado, Utah, Minnesota, and Washington State that also exhibit high levels of prosperity. So I just want to take you on a little bit of a journey through what the index is saying about health. So just as a recap, there are 6 elements within the health pillar. So behavioural risk factors, looking at the conditions that people have that perhaps could lead to problems later on in life, developing disease or injury, or even actually suffering from premature death. So that's around obesity, smoking, etc. We then look at preventative interventions. So that's the extent to which a health system is able to prevent diseases and illnesses from occurring. Care systems looks at the accessibility to the healthcare system, as well as the capacity of that health system to treat and cure diseases once they are prevalent in the population. We then have a mental health element and a physical health element. And finally, in terms of outcomes, we look at the longevity in terms of the different mortality rates of certain age groups across. So this gives us a better measure rather than looking at life expectancy, because it's able to identify and pinpoint particular ages in the population which are perhaps exhibiting higher levels of deaths than perhaps they should be. So these 6 elements combined together, which are underpinned by 33 indicators, is our health pillar within the index. So when we look at how these elements perform over the past decade for the US as a whole, we see a very mixed performance. So starting in the top left, we've got, Stephen's already talked about a little bit, the behavioural risk factors. So we see that actually, despite the increase in obesity rates, the sort of reduction in other behavioural risk factors has actually led to that improving over the past decade. So going up on these charts is good, going down is bad. So behavioural risk factors have improved. But despite that, the US still ranks 165th globally out of 167 in our global index. When we look at preventative interventions, that has improved slightly over the past decade. On care systems, again, over the past few years, that has seen a considerable improvement. When we look at mental health, has already been identified and perhaps talked through in the video, we see that mental health of Americans has suffered and deteriorated over the past few years. And actually, we see a ranking of 150th in the global index. We also see a deterioration in physical health, and actually also in longevity over the past few years. We see that has also declined. But how does that map to the individual state? So once we add all of these 6 elements together, these 33 indicators, combine them, what does that tell us about the health across the 50 states of the Union and DC? So this map here shows those in green are the top performing states and those in red are the weakest performing states. And again, you'll see that clustered together in the sort of southeastern corner are those states which perform the weakest, with Hawaii, Minnesota, and Connecticut topping the rankings for health overall. So when we look at that in a little bit more detail, so here we've got the top 5 performing states on health, and then the weakest performing weakest 5 performing states on health, and then how that plays out across the different elements. We see that certain states on the top of the index perform pretty well across all different elements. So when we look at Hawaii and Minnesota, interestingly, when we look at California, whilst that performs well on 4 of the 6 elements around preventative interventions and care systems, it doesn't perform so well. And care systems obviously is almost a measure or some kind of signifier, if you like, of preparedness for the pandemic. So as states headed into the pandemic, they're having to deal, how well were their systems set up to deal with perhaps it's going to be putting a lot of excess pressure on those systems. When we cast our eyes to those at the bottom of the index for health, we actually see a bit of a mixed picture. There are some states like Arkansas that has a weak performance across all elements, but there are others which perform slightly better on some elements. But even so, apart from Mississippi ranking just in the first half of the table on mental health, all of the states are in the bottom half for these particular elements. So I just want to take you sort of one click down further, if you like, within the index, just to kind of show the depth of the index. And what you see here is some screenshots from the profiles that are available on our website, which is completely open source. There is a state profile for every state and for DC, which shows all the way down to the individual indicators within the elements, how a state is performing. So here we're looking at behavioral risk factors, and we've got the top performing state, Hawaii, in the middle, and West Virginia, the weakest performing state, on the right. And then as we look down the different indicators on obesity, smoking, alcohol use disorder, pain reliever use disorder, and illicit drug use disorder, we can compare and contrast the differences. So whilst we look at obesity in Hawaii, around a quarter of the population is obese, that compares to nearly 40% with West Virginia. The smoking rate in West Virginia is double that in Hawaii. But interestingly, when we look at alcohol use disorder, we see that West Virginia there is performing better on that particular measure. And one of the things we want the index to be used for, as alluded to in the video, is to be able to compare and contrast with other states and to see where perhaps a state is underperforming, where is there another state that's performing well, that it could learn, that it could benefit from. It could look at the initiatives, strategies, interventions that are perhaps taking place there that might be replicable in its own state. If we have a look at mental health, we see this is made up of the indicators on the left-hand side rates of suicide, rates of drug overdose deaths, serious mental illness, disability-weighted prevalence from mental illness, and where self-reported mental health is not good. So we try and combination of objective and subjective measures within the index, because we believe subjective measures are also important. So when these are added together, they give the overall score for mental health. And again, as we look across these indicators, we see quite a difference between these two states. California performs best for mental health, and West Virginia is the weakest performing state. So here you see that West Virginia performs poorly on all different measures. If you look at drug overdose deaths, it's nearly 5 times the rate than that of California. So finally, I just wanted to show longevity, because I'll be talking about this in a little bit more detail. So again, this captures each stage of life and what is the mortality rate for each stage. So looking at the 15 to 64 death rate, we see that whilst in California, that actually is reduced over the past decade, we see it has actually increased in Mississippi. One of the things that Stephen spoke about at the beginning was the opportunity within the index to actually compare and contrast across the index. So whilst we believe the index gives a very good and solid performance on health, and as I say, we were advised by 3 to 4 health experts in the US in constructing it, we're also able to compare and contrast across other aspects of the index. So these two charts here just show the relationship, the correlation between material resources, which is an element in living conditions, and longevity. And there, not surprisingly, you see that material resources are quite, so that's the extent to which people have enough finances to live on, to live a reasonable quality of life, and they have access to funds in case of an emergency. Perhaps no surprise. Similarly, with nutrition on the right, we see that there is a strong relationship between levels of nutrition and also longevity. But what that does allow us to do is also broaden it out to look at broader social determinants of health within the index. So this diagram here has health at the center. In the inner circle, we see those pillars with which there's the strongest relationship between health with. So living conditions, as I just talked to you about, but also in the natural environment, personal freedom and education, we find an R-squared of about 0.7. And then in the outer circle, there is also a relationship and association, but less strongly with these pillars. As again, as we said earlier, with 48 policy-focused elements, you're able to really drill down and unpick and interrogate in great detail the relationships that exist between these different aspects of prosperity. So I just want to return back. I said I would return back to talking about longevity and mortality rates. The chart at the top will be no surprise to people in the audience, I think, looking at life expectancy. It's been written about a lot lately, how life expectancy in the US has actually been declining over recent years. So whilst at the top going up is good, going down is bad. In the charts at the bottom, what we're looking at here is mortality rates. So actually going down is good and going up is bad. So just drawing your attention to the chart in the middle, the 15 to 64-year-old mortality rate. What we've seen over the past few years is actually an increase in mortality rate. And that's obviously also well documented through the depths of despair by Case and Deaton, looking particularly at the significant increase in deaths from drug overdoses, but also rates of suicide and also deaths from alcohol abuse. But one of the things I'll conclude with is just to talk a little bit about our county level prosperity index, which we've been building over the past years, of which this particular slide is a component. So this looks at the mortality rate of 15 to 64-year-olds for these 8 selected states, of which is our focus. So what you see here is just how they're distributed across the US and within these states. Again, perhaps no surprise, but there is significant variation and difference. So we have some states where the mortality rates are fairly homogeneous. If you look at New York State, for example, varies very differently to Georgia and Oklahoma. And in fact, when you look even just across these 8 states, we see considerable variation between the top performing county and the weakest performing counties. So Eagle County in Colorado has a mortality rate of 113, whereas when we look at Miller County in Georgia, that's got a mortality rate of 932 per 100,000 population. That's over 8 times higher, and that's just within these 8 states. What you'll obviously also notice if you're able to squint closely enough, is that around the urban areas, you'll see that the mortality rates are best. That, again, is no surprise. And we're able to group those together just to have a look at how they collectively, these 829 counties group. So when we look at the urban, they have a much lower mortality rate, around 1.5 times less than those of rural areas. And we actually see this urban-rural divide continue as we look across the different elements of health. As we sort of ladder this up to look at the elements of health, we see this difference continue. So here it's slightly the other way around, just to say that the higher the score, the better the performance. So when we look across the 6 elements of health, three shown here, so on behavioural risk factors, we again see that urban areas outperform rural areas. That is also the case on preventative interventions and care systems, but perhaps slightly less so than behavioural risk factors. As we look at the other 3 elements of health, we see similarly mental health in urban areas is better than it is in rural areas, similarly with physical health. And not surprisingly, as a result of all that collectively added together, we see that longevity is also better performance in urban areas, in urban counties, than in rural counties. And actually, when we look across the index, when we add in all the other components, all the other 10 pillars alongside health, we see that generally speaking, that overall performance continues. So we see that actually for prosperity as a whole, which this chart is showing, it shows that for the 829 counties in those 8 selected states, we see that the performance of urban areas overall outperforms those of rural. But this isn't universally the case. So there are specifically some things within the index where we see rural areas performing better. So for example, they have lower crime rates, they have stronger social capital overall. In particular, they have stronger social networks and they participate more in civic and social activities. However, on the flip side, we see that urban counties tend to have higher trust in institutions. We see, perhaps not surprisingly, that rural counties also have better air quality, as shown within the natural environment pillar. So I just want to sort of bring this up again to a final level, really, which is how we've looked at mortality rates, county mortality rates, as one of 215 indicators in our county index, which we've stood up this year. And this final slide really just shows how prosperity translates across the 829 counties within these 8 selected states. And as you can see, similarly to that for mortality rates, there is huge variation. You have some states that are very homogeneous in how prosperity translates across them, so Iowa, Colorado. But around other states, we see that there's quite a significant disparity or variation across them between the top performing county and the weakest performing county. So that sort of concludes the analysis I wanted to show today. Just hopefully you've got a sense through what I've talked through, just the extent of the health concepts and measures in the United States Prosperity Index, looking at the strongest and weakest performing states on the different elements of health, and also how they interrelate with other parts of the index. Our hope, our ambition, if you like, is that state and county leaders and other policymakers will use the index to develop data-driven policies that will increase the prosperity for all Americans. I'd just like to say all of that information that I've talked through is freely available. It's all open source on our website, usprosperity.net. And with that, I'd just like to say thank you very much for listening, and I will hand you back to Shelley. Thank you.
Thank you, Shaun. And can I please encourage you to keep sending through any questions you have using the Q&A feed. I've had quite a few questions already, and we'd like quite a few more, so please do keep sending them through. There are clearly a number of challenges ahead, especially due to the health and economic consequences of the COVID pandemic. However, there are also huge opportunities for the US to tackle inequalities and disparities and emerge more prosperous from this pandemic. To discuss some of those challenges and opportunities, I'll now turn to our expert panelists to offer their thoughts. Dr. Benjamin, if I can come to you first. As Executive Director of the American Public Health Association, we were acutely aware of the health challenges the US was already facing going into the pandemic. We are now living through a major health emergency. What concrete actions can and should we be taking to reinvigorate the health, wealth, and well-being of the nation?
Well, thank you very much. It's very clear now that we have to really put in place a new social compact for our society. And we have to address things that are going to be really impactful. So first of all, we need to make sure we have a system with everyone in and nobody out. We need to get health insurance coverage for all Americans. I think the second thing we need to do is begin to move very much upstream and invest in more primary care and more prevention. That also means that we have to address many of the social determinants that we see. The fact that the health outcomes that we're seeing, of course, are manifestations of the lack of investment in the social determinants of health. In many ways, one of the things we know is that we, as a nation, invest far less than other industrialized nations in our society. And I think that finally we have to fix the fractionation of our system. We have a very fractured healthcare system, a very fractured billing system, and that we saw that it's laid very much bare in COVID-19, where we, for example, not invested in the information infrastructure. So when we sent our children home from school, many of them were unable to simply do their basic schoolwork. So those are some of the basic things that we need to do. And we know that education is a strong determinant of the health outcomes of the community.
Great. And thank you so much for your comments. And I look forward to coming back to you during the Q&A, because I'm sure we'll have much more to ask you. Dr. Choucair, as Chief Health Officer at Kaiser Permanente, you oversee the organization's efforts to address the social health of your 12.4 million members via the nation's largest social health network. What do you mean by social health? What impact has the pandemic had in this area? And how might the United States Prosperity Index lead federal, state, and community leaders to better policy solutions?
Thank you for having me on this panel. What a great presentation by the team about the Prosperity Index. And let me start by saying, as an organization, we have for 75 plus years, we have always focused on lifting up the health and well-being of our members. And today, we have over 12.4 million people across this country who trust us with their care and coverage. And as we think about our understanding of health, what would it take for our members to be able to achieve their full potential, to be able to live the lives that they'd want to live? We're becoming more and more convinced that we have to be able to pay attention to our members' physical health. We have to be able to pay attention to our members' mental health, and we have to be able to pay attention to our members' social health. And we have to be thinking about those in an integrated fashion. There is no way we can optimize our members' health by just focusing on their physical health and mental health. So let me give you some of what we've learned over the last few years around our members' social health. So just last year, we have commissioned the survey of a representative sample of Americans, people living in this country across multiple geography, multiple communities. And what we've learned, and we've asked this representative sample about social needs. We've asked them if they faced food insecurity. We've asked them if they have housing instability, if they're having transportation issues, if they're having economic stress, or if they're not able to, if they're having social isolation issues. And what we've learned from that survey is that 68% of people living in this country have at least one unmet social need in the last year. And we've also learned that 1 in 4 people in this country have had an unmet social need that directly impacted their health. So 1 in 4 people in the United States are having to make tough choices between, do I pay my rent or do I get my medication? Do I buy food to put food on my dinner table, or do I pay my co-insurance or my deductible to get my surgery done that I absolutely need? So when you think about our role as a health system, we have an utmost responsibility to be able to support those members with their social needs the same way we think about their physical health and their mental health. And that was part of our effort to create our social health network across all 39 of our service areas across the country, to build networks of social providers who are there to support our members' social health. The same way we have a network of primary care docs and specialists to support our members' physical health, the same way we have a network of mental health providers and psychiatrists and counselors to support the mental health need of our members. And we are integrating all of that through our electronic health record system that now brings all these different pillars to health for our members in a way that we've never done before, and doing it at scale in all of our 8 states and all of our a footprint that we're participating, we're providing care and coverage for our members. And I do want to end by lifting up something Georges was just very clear in articulating. Addressing people's social health needs is so important, and yet it's not enough because it is truly downstream. We have to be thinking about more upstream interventions to try to think about the policy, the systems, the environmental changes that are needed so that people are not actually having those social needs from the get-go. That's why, as an organization, we've been extremely vocal about the role that health systems could play in aligning with the private sector, public health agencies, around housing issues. We've been very vocally active and supportive of policy change around affordable housing. We're investing $200 million of our Treasury Department to do impact investments across our footprint to expand access to affordable housing units across our footprint. We're actively engaging on the food front with policy and advocacy changes to make sure that we're addressing the root causes of food insecurity in this country. And just last week, as a part of our response to the civil unrest that we're seeing across the country in response to the killing of George Floyd and others, we've stepped up our support around addressing head-on things like systemic racism and trauma in this country, because we truly believe that those issues matter to health the same way your blood pressure matters to your health. And if we as an organization, particularly organization the size of Kaiser Permanente, is not stepping up and bringing these issues to the forefront, we can't expect others to do that as well. So we're so proud of the work that we're doing on downstream determinants of health, if you want, which is all the social health needs that our members are facing in our communities that have been tremendously exacerbated by the pandemic, but also remembering that we have a role to play as well in more upstream policy change, systems change that are so important in this country so that we end up to having a more equitable society and really a step forward toward our social justice journey in this country. So I'll conclude my remarks here, and I look forward to the conversation. And it's great to be on the panel with Georges, with Steve, and with Shaun, and with you, Shelley.
Thank you so much. Thank you, Dr. Benjamin. Thank you, Dr. Choucair. And that's such useful insights. We're now going to address some of the questions that you've sent in for the speakers and panelists through the Q&A. Again, please do keep them coming through. And I will, Stephen, if I can come to you first. We've had a question from Colette. With COVID front of mind and new spikes in Texas, Florida, and Arizona, what aspects of the pandemic does the index measure, and how might it help our community, state, and federal leaders make better policy so we can achieve a sustainable recovery?
Well, thank you, Shelley, and thank you, Colette. It's obviously a very, very important topical issue. Let me start with the bad news and then give you the good news. The bad news is that because we capture data on an annual basis, the index that we'll be publishing in a couple of weeks' time, unfortunately, will not have captured the impact of the pandemic insofar as data that will have been registered in February will not have seen what's happened in March, April, May, June. So I'm afraid when we publish, we won't show the consequence of the pandemic. But I think what we will be able to do certainly is next year, and as Shaun has highlighted, by looking at, say, longevity by different age groups, I would expect that that older age group, we will really be able to see across every state and county exactly where the greatest impacts have been, given that that particular age group is the one that's been most affected. But where we are today with the index, and I think, Bechara has just laid out, so many components of the index, as he's described all these upstream and downstream determinants, we can paint a picture of where states were they ready, were they prepared or not. So if you think about, to take on the behavioral risk factors, obesity, one of the big determinants of the impact of COVID, we can see that there was a massive range in levels of obesity around the country. So that's something that, from a public health point of view, going forward, would want to be addressed. When we look at how this pandemic transmitted through human movement and transport networks, what we've been able to see, and we have done this analysis to say the point of early outbreak were, of course, the same ones that in our transportation and connectedness elements, were actually high and regarded as good, because, of course, that human contact, that sense of being able to communicate and move and exchange ideas and capital and people is exactly the same vector transmission for the virus. So one level, that's the flip side of that coin about being connected, is that, of course, it makes you more susceptible to these areas. On the other hand, what we're also able to see, this has been validated at a global level, is that quality of governance, effectiveness of government has been a big determining factor about how the response has gone. So those nations globally that have better quality government have been able to, more effective government, have been able to contain the impact by being decisive and actually being able to bring the people with them, whereas those with poorer quality government have been less effective. And we're starting to see hints of that across the United States as well. So it's really, there are the social determinants of COVID and COVID impact that we can already measure. And then the impact, the downstream impact, I expect next year's index will be laying out in quite some detail.
Great, thank you, Stephen. That's really helpful. Shaun, this may be a very quick one to answer, but I think it's still worth asking. Adiba has asked, does longevity mean life expectancy rate? Ooh, you're just on mute, Shaun.
I saw that in the Q&A, and I was going to say, well, the thing is with life expectancy is that it's the average number of years that somebody can expect to live when they're born. And that obviously depends on where you're born. And in a sense, it doesn't really give you much more information than that. So what we felt was more useful in the index is actually breaking that down to the different ages, the different mortality rates at different stages of life. So because that then is actually something that you can initiate policy responses on. So if you're seeing that you have perhaps higher than average death rates at in maternal stage, and maternal mortality is high, then you need to look at a particular aspect of health service there. But if it's around 5 to 14-year-olds, then again, that could require a very different policy response. So we've taken life expectancy and turned it into what we believe is perhaps a more policy-focused outcome.
One thing to add, Shelley, one other indicator that we've been keeping a close eye on, and we've been trying to figure out how to translate some of our clinical outcomes into, is the Healthy Life Years Index, and would love to hear from others on that perspective as well. So we truly believe that the longevity is an important element. The life expectancy is important to track, but also is the quality of life so important to track. So how much of those years that you're living are morbidity-free, disability-free? I think those are relevant metrics that we're starting to track. And we're also realizing more and more that it's the we also want to include a concept of a well-being for that individual. It's easier to track how long you live, how many of those years are disability-free or morbidity-free, but it's also important to track how people are feeling about their life. So that's well-being index is another factor that we're trying to incorporate in the way as an organization we've been thinking about what we've been calling healthy life years. So I just wanted to add that to that conversation as well.
That's brilliant. Thank you so much. Stephen, can I come to you on that?
Yeah, sure. So I think, two parts to this. One, in terms of the self-scoring view, Shaun's already mentioned we do take subjective measures into account deliberately to make sure that we're not just running it by the numbers, as it were, but if people say they're feeling good, that's an important positive thing. And then I absolutely agree with you that the quality of life is critically important, and at one level that's why we've got the physical health and the mental health to say of those who are alive, what's their quality of physical health, what's their quality of mental health. And at one level we wanted to try and differentiate the quality and the longevity. So we're sort of unpicking the quality adjusted life years into life years and the quality of those. Multiply the two together and you get what you were talking about.
Fantastic, thank you.
Brilliant. We've had a question from Anna Cathell. To both yourselves, Dr. Benjamin and Dr. Choucair. The power of the index is that it can show which states are better at translating economic prosperity into social well-being and vice versa. In your experience, what policy interventions have had or would have the most impact in driving genuinely inclusive health, wealth, and well-being? Dr. Choucair, could I come to you first with that one?
I'm sure, happy to weigh in. And I know I'd love to hear what Dr. Benjamin has to say here. I want to start by emphasizing that the policy changes that we'd like to see need to happen at all different levels of government. And I'm assuming Dr. Benjamin will comment a little bit more about the policy changes that need to happen at a federal level. There's tons of policy that we'd like to see at a state level. But I'm going to take a moment to just lift up the importance of local government. And I served as the health commissioner in Chicago for 5 years, and I was able to realize how much local government can advance policies that would make a difference. So one effort I'd like to highlight here in the United States is an effort, a joint effort by Kaiser Permanente and the Beaumont Foundation called City Health. And this effort identified the 40 largest cities in the United States, identified 9 very concrete policies that local government can take that can advance community health, and then really develop work plans with those largest cities to help them on a roadmap to get them to adopt those policies, and even issues yearly report to kind of describe where each city is, and even offers a medal for those cities. And those policies are things anywhere from tobacco-free policies to procurement policies on food and others, to policies on alcohol, zoning policies, all the way to paid sick leave, as well as other policies that we know make a difference on community health overall. So I would encourage folks to check out that effort. It's called City Health, and it targets specifically opportunities and 9 policies that local government can take to make a difference when it comes to health. And I'll turn over to George, as I know he's got a lot to add on this front.
Well, it's interesting. I agree with that. And that, by the way, City Health is a great metric and tool for local elected officials to use to advance the health of their communities. But I would focus on 2 things. Number one, I'd focus like a laser on education. We have not adequately invested in education in this country. What we pay teachers, the education and engagement of students. We still have students that are in facilities that you would not want your students, your children to go to school in. They don't have the books that they need. We still have teachers that are buying their own supplies. So we have thoroughly underinvested in our school systems. And of course, we have enormous disparities in the resources that we give the various schools in many, many of our communities. It's not just the urban settings, it's also in our rural communities. The second thing I would focus on is a living wage. Obviously, we pay far too little to the right people that need to be adequately funded. And we have huge disparities. We have big disparities between what we pay women compared to men. We have disparities based on race. And we have disparities in the job market. And the job market has dramatically changed. There was a time when a lot of us, our first job was doing a paper route and, of course, migrating to pick a fast food place to work. But far too many people who have to support their families are now living in a lot of these places that pay a relatively low wage. The fast food places are the role model for that, unfortunately. And so paying people adequately to deal with that income gap and educating people to deal with the educational gap, I believe will go a long way to allowing people to become much more self-sufficient and addressing some of these problems we have.
Brilliant. Thank you so much both. And that's so insightful. I'm aware that everyone's quite busy and our speakers have other calls to go on to. So we've probably got time for one more question. And I'm going to direct this one to you, Stephen. And I hope I get this right, Anne. Anne has sent through a question. Through implementation and intervention, it is possible to enhance and amplify the impact of the USPI. Would it be possible to organize a forum or symposium to bring officers, health experts, and researchers from counties with high and low index for discussions and interactions? This may help develop new policies and strategies to improve the well-being in counties with low rankings. In addition, counties with increasing rankings over time can be highlighted to provide insight into how changes are made and implemented and to improve well-being and prosperity. Stephen, what do you think about Anne's suggestion?
Well, there's a short one-word answer to it. Yes, absolutely. And it's very much in the spirit of what we're keen to do with this index, which is to find pockets of success, help others learn from it. And also, I think you very aptly describe, who has improved, because that rate of progress is a good indicator of having but good things in place. And for us, as we look around the world, when we do our work around the world, we're always trying to find the improvers and say, what can we all collectively learn from those countries or those states that have improved the most? So I would say yes, but not just in health. I mean, there are multiple pillars that we can work through and say who's done the best in improving living conditions, back to what Dr. Benjamin was just saying with respect to either wages or other issues. Who's done the best in improving social tolerance, for example? Who's done the best in improving the quality of governance? These are all issues that affect people's well-being, and I would be absolutely up for arranging a set of symposia on each of those topics, taking strong performers, good improvers, and helping to sort of share the experience and lessons learned.
Brilliant. Well, Anne, I think we might be in touch to get you involved in that symposium, and maybe we can convince Dr. Benjamin and Dr. Choucair to join us on that as well. We're going to have to wrap up, but thank you to all those who submitted questions and comments, and to our speakers and panelists for their insight. I hope today's discussion will encourage wider and continued engagement across the US as we emerge from this extraordinary time. As a reminder, you can find more information, including all our raw data sets, at our website, www.usprosperity.net. Today's events, as well as the other webinars in this series, have been recorded, and we'll be in touch with details of how to access these recordings once they're available. At the Legatum Institute, we create indexes, publish reports, and host events to help leaders, policymakers, and influencers at every level identify the practical solutions that will deliver real and lasting prosperity. As mentioned earlier, later this month, we'll be launching our new and improved United States Prosperity Index, which will include detailed county-level analysis for several key states. We'll also be hosting a launch event in September with an impressive lineup of speakers and panelists to mark its publication and to continue the important conversation like the one we've had today. We'll be sure to send you further details of this event. Please make full use of our indexes and their related resources to help set agendas for growth and development and create roadmaps to improve institutional, economic, and social well-being for all Americans. Thank you so much for joining us today, and a special thank you again to our expert panelists for generously giving us their time and for their insightful perspectives. I hope you have a wonderful rest of the day. Thank you.